From our last classes, we could know about little bit alkaloids, their nature, their physical characteristics, little bit its chemical characteristics, and then we elucidate the structure of nicotine. And today we will go for hygrine. We will elucidate the structure of hygrine as well as with some medicinal uses of some alkaloids. So let's start with hygrine. See, the hygrine has the molecular formula C8H15NO. Its boiling point is 19 degree centigrade. It is extracted actually as a thick yellow oil having a pungent taste and odor. Right? It is a pyrrolidine alkaloid. Regarding occurrence, it is a pyrrolidine alkaloid which is found mainly in coca leaves. Right? And first it was isolated by Karl Lieberman as an alkaloid accompanying cocaine in coca. Let's go for structure elucidation. As we know that the molecular formula of hygrine is C8H15NO. Its reaction shows that it contains a keto group as well as a tertiary nitrogen atom. So, it contains a keto group and tertiary nitrogen atom. By various chemical reactions, we can determine this one. When on oxidation with chromic acid, the hygrinic acid is formed from the hygrine. So, on oxidation with chromic acid, hygrinic acid is formed, right? So, it is the hygrine, and on oxidation it will generate the hygrinic acid. And again, when the hygrinic acid is subjected to dry distillation, then what will happen? The hygrinic acid gives N-methylpyrrolidine. Hence, hygrinic acid is an N-methylpyrrolidine carboxylic acid. So, by that reaction, overall reaction, that is from hygrine on oxidation with chromic acid, it will yield hygrinic acid which on dry distillation yields the N-methylpyrrolidine. So, from that we can conclude that hygrinic acid, this one, is an N-methylpyrrolidine carboxylic acid. So, hygrinic acid should contain an N-methylpyrrolidine with a carboxylic acid group. See, hygrinic acid undergoes decarboxylation reactions very readily. So, we can conclude that carboxylic acid group is present at 2 position, which is by analogy with the alpha amino acid. So, as from the hygrinic acid, the decarboxylation reactions goes very rapidly, very readily. So, it is confirmed that the carboxylic acid group is present at 2 position by analogy with the alpha amino acid. Next, the structure. 1-methylpyrrolidine 2-carboxylic acid for hygrinic acid was confirmed by Willstatter synthesis. So, he took the 1,3-dibromopropane. Next, it is reacting with diethyl malonate. So, it is diethyl malonate, monosodiodiethyl malonate. So, here that CH minus will be reacting with the 1,3-dibromopropane. So, here a nucleophilic substitution reaction will be occurring where the Na beer will be removing. So that the product will be BrCH2, CH2, CH2, CH, COO, C2H5 whole twice, and that Na and beer, it will be going out, right? Next will be occurring, this one will undergo reaction with bromine, so that the H beer will be removing out. So the product will be CH2, 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 C, COO, C2H5 whole twice. Here one bromine will be attaching, right? So one bromine over here it is attached. So the total structure will be like that, and afterwards by reaction with methylamine, one H pair will be removed, so that cyclization will be occurring. So that NH2 will be attacking is CH2, so that bromine will be removed out. Next case, that NH again will be attacking over here. Again one beer will be going out. So that it will be a cyclization reaction, and finally this type of product will be generating. And finally this one, on heating in presence of H2O, that 2 ethanol molecule will be removing, so that here is a 2 carboxylic acid group linked over the 2 position, second position, and next by decarboxylation reaction at 160 degrees centigrade, it will be our hygrinic acid. So the possible structure of hygrine will be this one or this one. So the side chain will contain either CH2COCH3 or COCH2CH3. Now, the formation of hygrinic acid on oxidation of hygrine, a side chain containing C3H5O. That side chain C3H5O or this one C3H5O must be present at C2 position of N-methyl pyrrolidine nucleus. And finally, Annette et al. Have synthesized hygrine by condensing gamma-methyl aminobutyraldehyde with ethyl acetoacetate in a buffered solution at pH is equal to 7. So here is the reaction, condensation reaction, and the product is this hygrine. So this product resembles to naturally occurring hygrine and give all the reactions discussed. It also gives iodoform taste, right? So the product also gives the iodoform taste because of the COCH3 group present in the compound. Then the Carrier et al. Showed that minus hygrinic acid was related to L plus glutamic acid and L minus proline. By series of reaction it was determined. Then Lewis et al. Showed that the hygrinic acid obtained by the oxidation of hygrine, it had the same direction of rotation as that of its precursor, that means the hygrine. So in this way the structure of hygrine was determined. Our next topic is the medicinal uses of some alkaloids, right? So first of all we will take cocaine. It is a valuable therapeutic agent because of its paralyzing effect on sensory nerve endings, which gives a local anesthetic. So therapeutic means if something is therapeutic, it helps you to relax or to feel better. means to treat an illness or to improve one's health. So it is used as medicine to improve your condition, to feel you make better, right? So you will feel better by therapeutic agent. Then it causes dilation of pupils by central and peripheral stimulation of the pupillodilator mechanism. So dilation means widening of the pupils of eyes. It is used in ophthalmologic examination. Ophthalmologic examination. Right? Next is, though highly toxic, it produces a condition of euphoria, a feeling of happiness. It is a strong narcotic and habit forming on prolonged use. Narcotic means causing drowsiness. It has been used as stimulant also by the especially South American Indians. The nicotine. Nicotine, it has limited therapeutic use. There is a growing evidence that it may be useful in treating Parkinson's diseases as well as Alzheimer's diseases. Nicotine salts are mainly used as insecticides. In animals, small quantity of nicotine can be used for the treatment of such diseases. What is Parkinson? It is actually a disorder of the central nervous system that affects your movement, loss of balance, nerve cell damage in the brain. And Alzheimer's, same type of diseases, it destroys your memory and other mental functions. Confusion is one of the symptoms. Also here brain cells die, problem with thinking and behavior, also another symptoms. Hygrine. Hygrine it is used as sedative, hypnotic, laxative or as diuretic. Sedative means drug taken for its calming, sleep inducing effect. Generally works by modulating signals within the central nervous system. In case of hypnotic, it is related to hypnosis, sleeping drugs, class of like psychoactive drugs. Laxative, it is taken for actually constipation. Constipation means it is used to lose the bowel. Diuretic, it is designed to increase the amount of water and salts expelled from the body as urine, and it is helpful to treat high blood pressure. Quinine. Quinine it is a well-known anti-malarial drug and a febrifuge. Febrifuge means that reduces the fever. Antipyretic. Quinine and its salts, especially chloride and sulfates, are used in the form of drugs to kill malarial parasite Plasmodium. It stimulates hair growth also, and to treat also leg cramps caused by vascular spasm. The quinine is used. Morphine. Morphine, its hydrochloride, is generally used as a sedative and for the alleviation of pain. That means analgesic. Used to relieve pain. The pain may be moderate to severe in both acute or chronic management. Sometimes general anesthetic it is used. Maybe in case of cough suppressant or antidiarrheal, effective is the morphine. And the next is our reserpine. You know that reserpine is useful for the treatment of high blood pressure, right? Actually, usually in combination with a thiazide diuretic or vasodilator. Vasodilator means it is used to open blood vessels. So blood flows more easily and there is a relaxation of the smooth muscle of the vessel. It is lipid soluble and can penetrate the blood-brain barrier. It is an orally well resorbed, centrally and peripherally effective. Side effects of reserpine includes nausea, that means sudden vomiting tendency, directly vomiting, diarrhea, loss of appetite, headache, dizziness, drowsiness. Also, the reserpine is used in diuretic cases as well as vasodilator problems. So these are few alkaloids and we have seen the medicinal uses. So that's all for this day. We will go next day with some questions related to the alkaloids. So you may deal with question like transform from hygrine to hygrinic acid, from nicotine to some other compounds like that. There may be some question of medicinal uses of a particular alkaloids. It may be structural elucidation of any particular alkaloid like that. Okay, thank you.